Clinical handover within the emergency care is a frequent and highly critical task in clinical practice. Continuity of patient care is guaranteed by joint activity and dialogue between emergency ambulance crew, EAC, and hospital emergency medical service professionals. The need to exchange necessary, complete, and precise information ensures an effective handover and reduces possible threats to patient safety. Therefore, patient transfer principles, compiled as models of clinical handover, reduce communication failures that can lead to treatment delays and corresponding adverse effects. The IMI-ST-AMBO protocol, IMI-STEMBO protocol, covers the standard way paramedics hand over information about patients to receiving emergency department staff, where I stands for identification, M for mechanism of injury or medical complaint, I for injuries or information related to the complaint, S for signs, T for treatment and trends, A for allergies, M for medications, B for background history, and O for other information. The emergency ambulance crew has just arrived at the ED of a local children's hospital.
What happened?
We have an 8-year-old boy here, run over by a passenger car, with multiple injuries.
Do you have any more details?
He was riding a bicycle and forced the right of way at the intersection. He was hit on his left side, and he was not wearing a helmet.
What about the vehicle?
The passenger car was traveling at about 40 kilometers per hour, has a damaged bumper, hood, and windshield. The driver sustained no injuries. He's being interviewed by the police officers now. The child was found about 2 meters in front of the hood of the vehicle.
Identified injuries with the boy?
Unconscious from the start of the incident, with a bleeding wound from an open left forearm fracture and a left shin fracture. Visible head trauma.
The results of the clinical examination?
In a quick trauma examination, it was evident that the airways need to be opened. Own breathing was efficient and a pulse was observable in the radial artery.
Procedures performed.
First, the airway was cleared by means of the mandible protrusion maneuver and the cervical spine was manually stabilized. Effective application of the dressing on the bleeding wound on the forearm.
And any other observations from the physical examination?
Contusion in the frontal region on the right side. Anisocoria, left pupil larger than the right. Cervical spine positioned in the body axis and no increased paravertebral tension.
Okay, clear.
Trachea centered, jugular veins collapsed.
What about internal body sounds?
Auscultatory, muffled vesicular murmurs on the left, and visible percussion sound. That gives us suspicion of pleural bleeding.
And abdominopelvic cavity?
Abdomen soft, without pathological resistance and muscle defense. Pelvis stable.
Treatment applied.
Load and go mode has been decided due to cross fracture. For the duration of transfer to the ambulance, a cervical collar was put on and the child was placed on a pediboard. Mechanical ventilation was started in the continuous mandatory ventilation mode.
And on the transfer?
In the ambulance, the cervical collar was removed, the trachea was intubated. Analogous sedation in the form of midazolam fentanyl rocuronium was applied.
Noted.
During transport, reassessment was performed, mechanical ventilation through the endotracheal tube applied. Efficient and hyperkinetic circulation noticeable. Persistent anisocoria.
Any other observations on the way?
The dressing on the left forearm is not bloody. The fracture on the lower leg is stabilized on the board. Left foot warmed and properly supplied with blood.
Anything on the background history?
No burdened medical history, no drug allergy, last meal an hour ago. The patient's mom is present, currently in shock, but the sedatives applied should calm her down soon. She should be able to give you any further information as needed in a moment.
Thank you so much. We have complete information now. Our trauma team is ready to continue the emergency treatment.
Good to hear that. See you next time.